Hello, everyone. Have you been told by your doctor to take your medicine on an empty stomach? What does that mean exactly? Does it mean right before you eat? Does it mean while you're eating? Does it mean after you finish eating? And what if you miss a meal? Are you allowed to skip meals so you can take your medicines? Today, we'll answer these frequently asked questions about taking medications on an empty stomach. Before we start, please click the subscribe button below. Some of you who haven't subscribed yet might not be receiving our videos regularly. So please check your subscription status. You've had your medication prescribed by your doctor because you have a health problem or to prevent one. Your doctor also gives you instructions on how to take this medicine. Most commonly, the instructions will tell you to take the dose once or twice daily, every 8 hours or every 12 hours. But sometimes your doctor instructs you to take the medicine on an empty stomach. So when should you do that? An empty stomach means different things to different people. Some think it means right before a meal. Others believe it means during a meal, and others still think it means any time after a meal. The truth is that taking medicine after a meal may reduce its effectiveness or increase its side effects. So what does taking medicine on an empty stomach really mean? It means taking the dose either 30 minutes before a meal or 2 hours after a meal. This applies both for solid and liquid medicines. Why is it important to take some medications on an empty stomach? Medicine is absorbed from the intestines into the blood, and then it gets distributed throughout the body via the circulatory system to reach its target. Various factors can affect how well the medicine gets absorbed at the site of action. For instance, the type of food in the stomach and the composition of the gut microbiota can change the way our body absorbs the drug molecules. Certain foods can interact with the medicine and slow down or even stop its absorption. Other foods can speed up absorption, causing higher levels of the drug in the body than intended. This can increase the medicine's effectiveness, but also raise the risk of side effects. Therefore, to ensure that the correct amount of medicine reaches its target, doctors often recommend that patients take certain drugs on an empty stomach. This is particularly true for medicines which have a narrow therapeutic index, meaning that there's a small margin between the effective and toxic doses of the drug. So what are some examples of medications that should be taken on an empty stomach? One example is isotretinoin capsules. Isotretinoin is a derivative of vitamin A used to treat severe acne and other conditions. Taking it along with food reduces its absorption by 40%, affecting its effectiveness. Another example is ketoconazole. This antifungal medication is used to treat fungal skin and nail infections. It's also available as a cream or lotion. When ketoconazole is taken with food, absorption is reduced by 50%. If a person misses a dose, they should try to make up for it as soon as possible, unless it's almost time for the next dose. Then they should wait until then to take the next dose. People shouldn't skip meals just to take their medicine on an empty stomach. They should take the dose whenever they remember, then resume normal eating habits. Another example is levothyroxine sodium tablets. These are used to treat hypothyroidism, a condition in which the thyroid gland doesn't produce enough hormones. Taking levothyroxine with food lowers its absorption by 25 to 50%, decreasing its effectiveness. People who take levothyroxine should also avoid taking antacids containing aluminum or magnesium within 2 hours of taking their dose. Then we have metoprolol succinate tablets. These are part of a group of drugs called beta blockers used to treat high blood pressure and angina. Metoprolol is also used after a heart attack to lower the risk of death from cardiovascular causes. When metoprolol succinate is taken with food, its absorption is delayed, meaning that it takes longer for the drug to enter the bloodstream. This can cause problems if the person needs a quick onset of action, such as during a hypertensive crisis. However, the extended-release version of metoprolol, known as metoprolol tartrate, has a slower onset of action anyway, so it's generally taken with food to avoid problems. Next is nifedipine capsules, which are part of a group of drugs called calcium channel blockers. Nifedipine is used to treat high blood pressure and angina. It's also available as a sustained-release formulation called GITS. Nifedipine can cause significant side effects such as headaches, dizziness, and flushing. These side effects occur when the drug rapidly enters the bloodstream and produces a sudden drop in blood pressure. Since the absorption of nifedipine is slowed by food, it should be taken with a meal to reduce these side effects. Then we have ciprofloxacin tablets, which are part of a group of drugs called fluoroquinolones. Ciprofloxacin is a broad-spectrum antibiotic used to treat bacterial infections. Like other antibiotics, it should be taken exactly as directed by the doctor. This is because taking it with food slows down its absorption and reduces the effectiveness of the drug. And finally, ranitidine tablets. These are part of a group of drugs called H2 blockers. Ranitidine is used to reduce the amount of acid produced in the stomach and is often used to treat heartburn, gastritis, and peptic ulcers. Food can decrease the absorption of cimetidine, so the dose is usually taken 30 minutes before a meal. The list of medications that should be taken on an empty stomach isn't exhaustive. Other examples include carbamazepine, lithium carbonate, salazopirin, oxalizine, hydralazine hydrochloride, captopril, enalapril maleate, spironolactone, digoxin, warfarin sodium, methotrexate sodium, probenecid sodium, and valproic acid. On the other hand, there are also drugs that should not be taken on an empty stomach because doing so can increase the risk of side effects. One example is aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. These are commonly used to relieve pain and inflammation. Taking them on an empty stomach increases the risk of stomach bleeding and ulcers. Another example is potassium chloride, a drug used to treat low potassium levels. It can cause an irregular heartbeat and other serious side effects if taken on an empty stomach. Then we have iron supplements, which are used to treat iron deficiency anemia. Taking them on an empty stomach can increase the risk of nausea, vomiting, and constipation. Other drugs that should not be taken on an empty stomach include ampicillin, amoxicillin, allopurinol, cimetidine, diazepam, estradiol, glimepiride, lisinopril, metolazone, prochlorperazine, quinine sulfate, sulfasalazine, and tetracycline. People should always read the package leaflet that comes with their medicine to learn about the recommended and undesirable side effects of the drug and how to take it correctly. In general, people should never take more than the recommended dose of a drug, even if it seems to be helping. And if they miss a dose, they should try to make it up as soon as possible unless it's almost time for the next dose. Then they should wait until then to take the next dose. People should never skip meals just to take their medicine on an empty stomach. Instead, they should take the dose whenever they remember and resume normal eating habits afterward. That was a quick overview of when to take medications on an empty stomach. Please ask your pharmacist or doctor if you have any questions. Share this video with those who might benefit. And don't forget to subscribe.